Should have phoned you up.
Well, good afternoon, everybody. We're delighted to be joined by the Chief Constable this afternoon, and I'm pleased to let you know that we have had some encouraging news in this phase of our fight back against COVID-19. The R rate for cases in the community has been pushed down to between 0.7 and 0.9. So together, over this last number of weeks, we've been able to break pathways of transmission and to slow the spread of the deadly virus in our community. And of course, this reflects the effort of people from all walks of life and our businesses, faith groups, charities and public sector organisations who have followed the public health advice to save lives. The Department of Health dashboard demonstrates our case doubling rates has now extended out to 55.5 days, compared with a UK average of 39 days and 17.8 days in the Irish Republic. So a huge thank you to everybody for everything that you're doing and continue to do. And I think it's important to say continue to do, because experience over this last 11 months tells us that this success, important as it is, does not alter the scale of the challenge that is ahead of us. What it does do is that it gives us time for us to push ahead with our strategy to protect you and your loved ones. We're continuing to work closely across all the nations of the UK to roll out our world-class vaccination and testing programmes. And today, the Health Minister and Patricia Donnelly, who heads up our vaccination programme, updated us and told us that by close of play yesterday, 102,701 people have been vaccinated. In 467 of our 483 care homes, residents have received a first dose, and in 72% of our care homes, they've had their second dose of the vaccination. Just over 21,000 of our over 80-year-olds have been vaccinated by GPs, and that's really good news as well. So by the end of the month, we expect all of our care home residents, our health and social care staff, and all of those over 80 to have received their first vaccination. That would be an incredible achievement, and it actually makes us one of the top performing countries across the globe. So today we have also agreed to pre-departure testing for international arrivals into Northern Ireland. This means that anyone arriving into Northern Ireland who has been outside of the common travel area within the previous 14 days must have evidence of a negative test in the last 72 hours. And of course, the requirement to self-isolate for 14 days remains on all such passengers. Ministers vented their frustration again at the lack of progress with the Irish Government regarding passenger locator forms and the information that we gain from those forms and how that impacts on us monitoring the extent of travellers who come through Dublin up into Northern Ireland. Now, the Attorney-General in the Republic has appeared to confirm that there should be no legal impediment to sharing that information. So ministers have asked us to elevate the matter and raise it again urgently with the Taoiseach. So that's just a few examples of the work we've been doing today to keep everyone safe from the infection. But of course we can't do that on our own. Given the nature of the fast-moving virus, we need everybody to work with us, because by taking positive action over this last number of weeks, we have helped to bring the rate down in Northern Ireland, and we're urging you to keep going. If everybody follows the health advice of staying at home, wearing face coverings and washing our hands well and often, we know that more lives will be saved in the coming weeks and months. Because right now we cannot afford to have a fresh surge of new cases. Our health service is under incredible, immense pressure, and this will get worse, unfortunately, in our health service before it gets better, as the number of those who have already contracted COVID and need specialist medical care rises over the next short period. Chief Medical Officer advised us today that the number of new hospital admissions with COVID should peak later this week, beginning of next week. However, the numbers being treated in our ICU departments are unlikely to peak for another week or so. So we're all now partners in protecting people and preventing a greater loss of life. And I'm delighted that one of our partners, our Chief Constable Simon, is with us today to provide an update on the important work of his officers on the ground to inform and encourage the public to keep those public health regulations and also, where necessary, to take decisive action to put a stop to reckless behaviour in our communities. Before I hand over to Michelle, I just have to say I find it incredible, frankly unbelievable, that there are still people who are holding house parties and other social gatherings at this time when the rest of us are fighting hard to give everybody a chance to live. I'll hand over to Michelle.
Thanks, Arlene, and good afternoon, everyone. And sadly, again, we've learned that 16 more people have died as a result of COVID-19, and we want to start by sending our sympathies to their families and to their friends. As Arlene has said, we've received a number of updates and we've had a number of conversations at the Executive today, and one of which was an excellent presentation from Patricia Donnelly, who's tasked with heading the vaccination programme. And I have to say that we were very encouraged by what has been achieved in such a short space of time. As of today, nearly 5% of the population has been vaccinated, and I think that's a really good achievement. We have teams of people working 7 days a week, and again, I want to commend all of those people who are working, delivering the vaccination at this time for all of us. Arlene talked about the significance of the success of our care homes. 97% of residents in care homes have been vaccinated so far with their first dose, and 72% have received the second dose, and that's hoping that that will be all completed, plus the over 80s by the end of the month. So I think that's, again, significant progress in the way forward. Actually, I would go as far as to say I think it's remarkable, and just want to put on record again our thanks for all those that have been involved in not just delivering the vaccine, but putting in the planning and the implementation and putting all that in place. We also know that people are very anxious about when will be their turn, and that's very understandable given the times that we live in, and we want to encourage everyone to be patient, and that we will get to you as quickly as possible. And I also encourage anyone who's in any doubt to come forward and to take the vaccine whenever it is offered to you, because that is our best defence against this virus. We've also received an update on the progress of the epidemic in the community, and as you will know, the Executive's policy has always been to try to keep the R rate below 1, and we're now seeing the very real impacts of the restrictions that we brought in back in December, on the 26th of December, and we're pleased that today the R rate is below 1, between 0.7 and 0.9. However, there is no room for us to be complacent, because we've been here before and we know that how quickly that can turn again on us, so we need people to still work with us. We absolutely understand that this is frustrating for people. We understand that, the implications for our lives and throughout all of this period, but people have stuck through and worked their way through this marathon, and we just need people to keep on going, and there is light at the end of the tunnel with the news of the vaccine. We know that the vast majority of people have been adhering to the measures that have been brought in, and we're very grateful to all of that, because people understand the significance of trying to protect the health service and to save lives. But as I said, we acknowledge how difficult this has been for everybody, and we want to thank everyone for your continued sacrifice, for yourself, for the good of your families, for the good of society as a whole, and indeed for the good of our health service. But we really do need people to still keep going and just to go that extra mile. And as I said, we can very quickly get to a position where the R rate can creep up. So I think that the other thing that we discussed today was that whilst we don't have a definitive position yet in terms of new variants, new strains coming in, we expect to get more information on that next week. But what it was said from the health team is that the likely percentage of that new strain is rising, so we have to be very mindful of that, and we know that this new strain can spread a lot quicker, so very, very mindful of that. So we all need to continue to follow the public health advice and to stay at home. The issue of travel, which Arlene referred to, and we did have a significant discussion on this issue again at the Executive, and the Health Minister did bring forward a paper on pre-departure testing for international arrivals. In addition to that, I also believe that we need to have the two-island approach for safer travel. The Common Travel Area does serve us well and has done for many, many years. But I think in this instance what we need to have is that two-islands approach, and what we need to have is the heads of government come together. So we have, as an executive, agreed to pursue meetings with both the Taoiseach, the Prime Minister and ourselves, and that needs to happen sooner rather than later. It needs to happen as a matter of urgency. Then finally, just on a separate note, the Executive received an update on the work of the Interdepartmental Working Group on Mother and Baby Homes, Magdalen Laundries and Historical Clerical Child Abuse. And I have to say that the report published in the South this week is truly harrowing, and the brutal and inhumane treatment of the women and children who endured the horror of the mother and baby homes was laid bare for us all to see. Across this island, women were failed, children were failed by those who should have protected them. And it's sad indictment on state, on church and society that this was the case. So let us say to all of you who have suffered that we see you and that we hear you. Myself and Arlene will meet with Minister Roderick O'Gorman next week to discuss these issues, and we're expecting that the work of the working group into the institutions in the north will be received before the end of the month. And whilst we can never make up for wrongs of the past, we certainly can do all that we can to make sure that victims and survivors get the acknowledgement and also get the support that they need in the here and now. Thank you. I'll hand over to the Chief Constable.
Well, thank you, First Minister and Deputy First Minister. Just a chance to say a few things from policing today. Obviously encouraged by the spectre of good news on the horizon in terms of the R rate and the vaccine, but also acknowledging there has been a lot of debate about police powers, the police use of powers and how we get the balance right. Since the new restrictions have started, we're averaging about 40 penalty notices a day to people who blatantly still want to ignore the regulations. I do wonder, though, whether the time is also to ask the question, is a focus on enforcement figures actually the right thing to do? Because I have to take my hat off, as much as to my officers and staff who are working hard to support the health service in this endeavour, but to the vast majority of the public who I've seen firsthand complying with the guidance and the regulations and trying so hard to fight the virus with us and do the right thing. For those of us that are trying to do the right thing, times are tough and we acknowledge that. But we want to work with you and keep encouraging the vast majority of people and indeed our unsung heroes. I think of our nurses, our posties, our bus drivers, a whole list of people that are keeping society going. And we're trying to work alongside you as the police to do our bit. It's time to dig deep, and we all recognise that now, even if the prospect of better times are on the horizon. But my plea is remembering to every one of you that what you do today and the choices you make affect the speed at which our life can return to the normality we all cherish. We won't turn a blind eye when people break the rules. We're here to apply our 4 E's. And if people are blatantly running house parties, as the First Minister has said, you can expect firm and swift enforcement. Thank you.
Thanks very much. First Minister, what you said in your opening comments, there seems to be a certain degree of frustration, even exasperation, with the Irish Government with these travel documents. Is that the case in the Executive? To the Deputy First Minister then, you're talking about a two-island approach, but if the Irish Government is not making information available, surely there simply isn't a one-island approach coming from the Irish Government. And Chief Constable, I know you're saying that maybe you shouldn't focus on enforcement, but the First Minister says that unbelievably people are still taking part in house parties. There is a hard core that aren't listening to the 3 E's. Surely you should be focusing on the 4th E, enforcement.
So in terms of the discussion we had today, unfortunately, Tracy, this has been a long-running saga about the travel locator forms. I do recall when we were at an NSMC in Dublin in, I think it was July, the issue was raised at that meeting. I know for sure that the Minister of Health has been raising it on numerous occasions at meetings and indeed in correspondence with his counterpart in Dublin. So it has been going on for far too long, and I think there was a general feeling of frustration around the whole of the executive table that we need to get a solution to this, and we need to do it now, because up until now we've been told that travel hasn't really been a feature in terms of what happens in Northern Ireland in relation to the spread of the virus. It's a very small amount of numbers if you look at our track and trace numbers. but we certainly want to have the information so that we can analyse whether travel is becoming an issue, and we need to have that travel location or travel locator information shared with us so that we can do that.
We've made the case in the travel locator forums on many occasions. I certainly raised it as recently as I think that was yesterday evening with the Taoiseach. This has been raised at NSMC meetings. It's been raised repeatedly. So the issue needs to be resolved. But the issue of the common travel area, way back, I think as far back as July, the executive had written, asked for a British Irish Council meeting because we believed that we needed to have that travel conversation way back then. Unfortunately, that hasn't happened, but it's very clear, it's a very common sense approach that I'm asking for, which is the sharing of information, which is how can we collaboratively work together to ensure that we put people's interests first and we make sure that we protect lives and livelihoods. So that's why we are asking for the conversation now, again, with both the Taoiseach and the British Prime Minister, because now is the time to have a clear two islands approach, because I think we're all at a critical juncture in terms of the virus spread. So it's really important and vital that we get this conversation now. There's all sorts of political sensitivities around the common travel area, but this is about public health. This is about what can we do collectively, and certainly I look forward to us having these conversations, and I would hope that they happen as a matter of urgency.
In relation to the question about enforcement, you're quite right. In one sense, we are absolutely here to uphold the law, but we also police with consent and the cooperation of people right across the country. And I think it's often too easy to focus on the figures in an environment like this. There are 40 people a day since the start of the new restrictions that really have disregard for what we're asking people to do. But let's remember the vast majority of the public are adapting how they're going about their daily lives to help bring the R rate down and fight the virus. But be assured that where we go into people's homes and there's blatant disregard of the rules, which now are very clear to people, we will take action to use the powers that we've been given by the Executive and enforce the law.
About Minister Poote's comments today, in which he claimed that as a result of the Northern Ireland Protocol there will be a shortage of food to hospitals and schools. I'd like to ask, is that scaremongering, and was it discussed at the Executive today?
No, it was discussed, as I understand it, at a meeting that Edwin was at with various supermarkets, and indeed at a meeting with Michael Gove. What he is pointing out is the grace period that has been granted currently by the EU under the protocol to supermarkets in relation to goods that they're bringing in, which they would see as prohibited. If that ends with no resolution, then there will be difficulties for our schools and for our hospitals. Now, of course, we do not want to get to that position, therefore there needs to be a solution found. He's not saying that there's an issue now, because there isn't an issue now in relation to our schools and hospitals, but I think we do need to take seriously, when it has been raised at various meetings, we need to take seriously the issue and get a resolution to it.
Both the Department of Education and the Department of Health have confirmed that there are no food shortage issues, so just to make that clear to the public, again, in case people are fearful, I think at the press conference 2 days ago I made it clear that whilst there was trade and adjustment shocks, and it was very clear that businesses on the British end weren't prepared for what was going to happen after the transition period ended, and therefore there's been disruption, but I am glad to say that there has been a restoration of the flow and trade of food, and I believe, well, certainly as of Tuesday past, we were back to over 95% of normal food flow, so I think that probably would be even more improved as we speak today.
First Minister and Deputy First Minister, you've called for a meeting with the Taoiseach and the Prime Minister to talk about the travel restrictions. What is it specifically that you want out of that meeting? And in terms of cross-border travel, Chief Constable, what will the role of the PSNI be in all this?
Well, in terms of what we want out of the meeting, first of all, we want a resolution to this long-running issue around travel locator data from the Republic of Ireland. Because as I understand it, quite a large number of people came onto the island for Christmas, if you take that as an example, and we didn't have that information shared in relation to people that came then up into Northern Ireland. And that doesn't allow us then to deal with the isolation issues that should have followed on from people coming into Northern Ireland. So I hope we can have those conversations around the sharing of information, because if we share information, then we're all in a better position to deal with the issues that we hope do not come to fruition. And we've heard today about about a new variant in Brazil, which is quite concerning, and you know that UK government have taken action in relation to that. So we always have to be alert because this virus is mutating, and therefore we need to be ready to deal with all of those issues.
So the advice right across this island and right across the two islands is to ask people to stay at home. So nobody should be taking any non-essential journeys. That's a very clear position that's been adopted. I would hope that the meeting itself gives us an opportunity to discuss all the issues that have been identified as still unresolved. So travel locator forms is of course one of those things. But it's really important that as we live within the common travel area, which I've said serves us well, but in this instance, when we're dealing with the public health crisis, I think it needs to go right to the top of government, that we have a political conversation around the situation as it currently is, and then what else can we do? What else can we do together to try to improve the situation? So I look forward to the conversation as quickly as possible. I think it needs to happen as a matter of urgency, and I regret that it hasn't happened before now.
I think from a policing perspective, I think a few things. On a general sense, we have regular dialogue with our colleagues in the Garda Síochána to make sure we're in lockstep as best we can, but we're policing slightly different environments and slightly different rules. But ultimately, if we get to a different position in terms of regulations, my job and that of my officers and staff is to follow the direction from the executive, and if there are new regulations, we will enforce them.
The Chief Medical Officer has said that the virus won't end in February, and we've already seen the AQE being postponed or cancelled, or whatever term you want to use. So does it therefore logically follow that because that is the prediction for February, that the next step would be that the restrictions that we're living under at the moment will be extended when you review them next week?
Well, I think we've always acted on the advice of our scientific advisors, so we'll wait to hear what the paper says, and we'll take our action from there. I don't think we can, I don't have a crystal ball. I've always said that none of this is inevitable, but I am really pleased to say that the greater number of people in Northern Ireland have been abiding by the advice and by the restrictions that were put in place since the 26th of December. And as a result, we're seeing the benefits of that in terms of the R number, in terms of positive cases. We haven't yet seen the benefit of it in our hospitals or in ICUs, but we will see that benefit coming through. And I really want to say to people that it just shows the importance of abiding by the restrictions, that we can stand here today and say that the R number for cases in the community is below 1. I think that's a very strong and positive thing to say, and people should take heart from that, and the fact that the vaccination programme is rolling out in such an effective way.
Nothing really to add to that. I think that covers it. Yeah.
Is it not time for the Northern Ireland Assembly to start sitting virtually? Does it not contradict the stay-at-home message if Assembly members are travelling to Belfast to sit?
So this is something that we actually are looking at. Obviously, in previous waves, we would have scaled back Assembly business. There's obviously, in all these things, we have to legislate, so we have to do our job. But where possible, we're encouraging MLAs to stay home, and only those that are necessary need to be there. We, as an executive, have actually written to the Speaker and asked for that to be looked at, and we expect that the position in terms of what we do in the Assembly will change after next week, whenever there's further discussion. So I think there will be attempts to try to limit the business to the necessary business that we need to do, particularly around regulations and everything else that's moving. But there shouldn't be any, I suppose, non-essential business moves. So we won't be bringing people together unnecessarily.
And then Lidl also came out today and said that their shelves are full and they're adjusting to take in local produce. Does this not mean that it's the Northern Ireland Protocol is not the issue, but rather that businesses just haven't prepared for Brexit?
Well, I think it's probably a mixture of the two. I think that, as Michelle has referenced, our Northern Ireland businesses were very much ready for the end of the transition period, or as ready as they could be, given the fact that the Trade and Cooperation Agreement wasn't signed at the very last minute. Unfortunately, some of our Great British companies weren't as in a ready position as our own were, and therefore that has caused difficulties. So I think there has been difficulties in that respect, but of course there are other parts of the protocol which will cause issues for our citizens here. I was pleased to see that the VAT on second-hand cars has been regulated, and hopefully we'll have a written statement on that in the near future. We still have to deal with the issue around tariff on steel. There are issues around travelling pets. There are a whole range of other issues that affect citizens in their everyday lives, so we need to work through all of those and find solutions to them.
And I'll just add, I mean, there's daily meetings every day to resolve those issues, and we're hopeful that there'll be progress on a range of things that have been identified as problematic this week. So in terms of, not really an awful lot to add to what has been said in terms of the issues I've identified it's very clear to the business community here, and also the British Government will recognise that the businesses on the British end were not ready. But obviously there's been a lot of work being done this week to try to get people ready, make sure that people understand what the process is, and we can already see things that are being ironed out.
First and Deputy First Ministers, you've said you're going to meet the Minister for Children in the Republic next week following the publication of the Mother and Baby report. And given the fact that Judith Gillespie's group is due to report by the end of this month, what's the purpose of that meeting and what do you hope to achieve?
Well, we think it's really important that, what happened to women in mother and baby homes happened the length and breadth of this island, and I think it's really important that we learn from each other's experiences. I think it's really important that if there is any good practice that we can pick up on that. I think it's really important that as we move forward, and certainly as we receive our report, and we've been told that it will be before the end of this month, that we're able to respond very speedily. So I think it's very timely. Actually, we actually had planned to meet the Minister even before we knew that we were getting the report this month, just as part of our preparation for that. So this is a very sensitive issue. It's a very harrowing issue. And we want to respond in the best way that we possibly can. So we just think it's timely that we would meet the Minister next week in advance of receiving the report over the next 2 weeks.
So I talked earlier, Vincent, about sharing information, and I think it is very important that we do share information, particularly on this traumatic period in the history of both jurisdictions, actually. And you know, of course, that some of the organisations that ran these institutions were all Ireland institutions, so therefore it is important that we have that conversation. We are very much looking forward to having the research report brought to us by the end of the month, and then looking to recommendations as to how we go forward. But we must at all times remember that this has to be victim-centred, it has to be victim-led, and whatever is in the best interests of those victims must be the way in which we move forward. We had a short conversation about that at the Executive today, and there's very much unanimity around that.
And Chief Constable, can I just ask you about police visibility? Throughout the past 10 months, I've had to travel across the border many times during this story. I can't remember any occasion where I travelled any distance without encountering a guarded checkpoint. I haven't encountered a single PSNI checkpoint in 10 months.
Well, obviously that's your personal experience, Vincent. I can assure you that right across the country, consistent with the situation around the virus at different moments in time, because obviously the restrictions have been different from spring to summer and now through to the winter, that we are doing our bit to enforce the regulations. Where we've needed to, we run vehicle checkpoints. We've done that sometimes in concert with the Garda Síochána, as I said earlier, and certainly in the last weekend you only have to look to our social media accounts, frankly, to show how we increase visibility right across the country. So we will use insight about where traffic flows are highest or where people are moving around beauty spots, and we will be conducting those checkpoints. We did last weekend, and we'll be doing the same this weekend to give our encouragement for the people that want to go too far to exercise to stay at home.
Hi there. In terms of an exit strategy, what is your plans this time around, and will anything be different this time around? Have you learnt from maybe any mistakes in the past that you will rectify now, maybe not coming out as quick as we did, say, in the summertime?
Well, we have a strategic task force that is looking at all of these issues. It's looking at how this has impacted upon citizens, on our economy. We're also using behavioural scientists in a way that perhaps we hadn't been using last year as well, to see what behaviour and how we can help use that behavioural science to inform what we're doing. So I think it is important. Obviously, every department has their own remit to deal with issues, but the task force is there to have a strategic overview, an umbrella-type organisation to try and help us to look strategically at how we plan to come out and absolutely look to recovery for our economy and, of course, our society as well. So there's huge challenges ahead for us. We don't underestimate them at all. However, we are putting in place, and we have put in place, the infrastructure to do all of that.
one for the Chief Constable as well. We saw some worrying reports from the PSNI today about scammers and using actually the vaccination programme to scam people out of money. Can you tell us a bit more about that and just what the public should be looking out for?
Well, we've seen a number of scams actually rise in the last few days about offering false vaccine and also pretending to be police officers. They've been reported again on social media. It's just to reassure the public that to be on their guard, particularly elderly and vulnerable people who seem to be particularly at risk of these scams. You can go onto the website Scamwise to see about advice to never give out personal details, password information, bank account details to somebody over the phone, because you're not going to ask for it, certainly not from the police or from a public authority. So my plea is, if you get that sort of call or if you see an unusual message on your phone, don't open the link on a phone and don't answer the phone, and take these people seriously, because they can move money from you and they can cause all sorts of upset as people's life savings are taken off them.
First Minister and Deputy First Minister, the Health Minister has said that there will be worse outcomes for cancer patients because of having to prioritise treatment for COVID patients. What's your message to scared patients right now who face losing out on treatment, or at the very least not getting the best treatment that they deserve?
Well, firstly, I mean, the health service is under huge pressure, as we know right now, but for anyone going through a cancer journey, that's the biggest thing in their life, and they deserve to have the health service to support them. Unfortunately, we have saw over the past couple of weeks where a number of health trusts have had to downturn services, and particularly in terms of red flag cancer patients, and that isn't a sustainable position to adopt. Whilst there may be a massive pressure on the health service right now, if there has to be any cancellations, they need to be very short term, and we need to get the services back on track. We certainly support the Health Minister in doing that. It's really, really important that and we understand very much that whilst the health service has to respond to the issue of COVID, everybody else doesn't stop having their conditions or, suffering with other different sicknesses and ailments. So it's really, really important that the health service is there for everybody, and that's why all these measures are so important. That's why we all have a part to play to try and take the pressure off the health service so that it can respond to both COVID patients and everybody else who may need the health service whenever they happen to need it.
So I think it's really important that the trusts very much work together, and I think they are working together across Northern Ireland, so that if a cancer operation is cancelled in one trust area, that they very quickly look to see whether they can access that surgery in another trust area, so that it's not postponed for a long period of time, but the shortest period of time possible. This is an absolutely horrendous situation for cancer patients to be in. And we are doing all we can to try and look at all of the different options to find other solutions for them. And as I say, the Health Minister has decided to look at this on a regional basis as opposed to what normally happens, which is in terms of trusts looking after their own patients. And I think that we certainly support him in doing that. And
an aside on Brexit, I was out at a fairly major Northern Ireland food manufacturer a couple of days ago, and they said that they were having problems getting supplies in because they couldn't get on the Trusted Trader scheme because they weren't based in Great Britain, they were based in Northern Ireland. They said that puts them at a significant disadvantage from anyone else doing exactly the same business that they do based in Great Britain. Is that going to change?
Well, they should be able to get in the Trusted Trader scheme, because the whole point of it was to help everybody that was trading either into Northern Ireland or out of Northern Ireland. So certainly, if you want to pass on that company's name, I'm quite happy to take that issue up for them. They certainly should be getting the support that they need to do the business at what is a very difficult time for businesses right across Northern Ireland.
On behalf of Willowbrook Farms, thank you very much.
Thank you. Oh, I know Willowbrook Farm very well. Thank you.
Okay, thank you very much.
Thanks.
Thank you.